Just a reminder that we are recording this session, and indeed right on cue, the recording has started. So just be aware of that, because obviously it will then be made available to members of the public to watch back, and indeed for any of us who were not able to attend. I don't think we'd received any governor apologies. We've got a couple of executive director apologies. Angela Hillary, our CEO, who's on holiday. But obviously you can see that Dave Mayer is here as Deputy Chief Exec and Acting Chief Exec, and Paul Sheldon, who's our our Finance Director of Finance at the moment. Paul is also absent. But before I kick off the full sort of formal part of the agenda, I would like to just wish everyone, I hope everyone had a good Christmas, and formally take an opportunity to wish you all a happy new year, and particularly a healthy new year, which feels important for us as an organisation, to support everyone to be healthy. So I hope everyone had a really good Christmas. I'd also just like to take the opportunity we need to recognise that whilst it's great to be here with all of you, this is a particularly challenging time in the NHS, and winter is always difficult. So I really just wanted to thank colleagues who I know many of whom will have worked over the Christmas period, and indeed in this sort of challenging days ahead with an industrial action going on. Just to thank all the colleagues who've been working so hard over this period to keep our services running for patients and members of the public. And I'm sure the council would want to join me in saying that. So just wanted to share that with you. So moving on through our agenda, declarations of interest. We obviously have our usual paper recording our interest, but just a reminder to all of you to send any updated declarations to the office for us to record any changes, and that should be an ongoing process with everybody. Minutes of the previous meeting then, our paper B. I just want to check with you that you're happy and content that the minutes are an accurate record of our last meeting, which feels like quite a long time ago with Christmas in between. So back in November. Everyone content to approve those minutes, or are there any areas that you'd like to correct if colleagues have got any comments? I'll take that as okay then, so we'll approve those minutes. Moving on to item 4, which is our action log and matters arising. Obviously, you're welcome to put your hand up if there are any matters arising from the minutes that you'd like to query, but there is an open action, which is action 66, and that was really to cover, to include a session on health inequalities or health equalities within a councillor governor's workshop. So I think that's open still at the moment, and one which we will schedule in due course. But we do like to note these items for future discussion that governors have asked us to cover. So any other matters arising that people would like to raise at this stage? No, good. Okay, let's get on then with the core content of our meeting today. So first of all, council matters, and obviously constitutional matters included in that. And on that note, I'd delighted to hand over for the first time in 2024 to Richard as our Director of Corporate Governance to take us through his report. Richard, then, please.
Thanks very much, Krishni. Good afternoon, everybody, and a very happy new year to you. Hopefully everybody's received the Director of Corporate Governance report, so I won't go through all of the details contained within it, just draw out a few things that are probably worth highlighting in particular. So the first was just to note that we will soon be launching our governor elections programme, and governors will be aware that following the changes to our constitution, this will mean that we've got a slight change to some of the constituency boundaries than what we've had before. I would certainly encourage governors that are coming to the end of their term to consider restanding again if they're able to do so. And indeed, we have taken on board some tremendous feedback that we've had in terms of our election materials. So hopefully this time round, we'll be able to more clearly articulate the role of the governor and how people can contribute to it. So thanks very much to those that have supported us with fine-tuning our resources. The second is membership engagement and representation. So you'll see from the table on page 2 that we are on track with all of our work programme at the moment against our 5 priorities. It's worth saying, of course, that there's still a long way to go with each of these priorities, but nevertheless we are making some positive progress. I would draw your attention to the 2 case studies that we've included in here, which are well worth a read or a watch if you haven't already had the opportunity to do so, to see some of the impact that we're now starting to have. And by we, I'm actually referring to the work that governors have done actually here with our programme. Also, as I've alluded to, really the programme is very much ongoing. We've got some future webinars in the diary, and I did in particular want to highlight the upcoming session that we're planning to have, in which we're going to invite governors and members actually to help shape our strategy or strategic objectives for next year. So this will be a really important session, I think, really to allow governors the opportunity to share perspectives from the membership and the wider public to inform then the board's decision about its strategy for next year. So do note the details there in the paper. And then the third area I just wanted to highlight relates to governor training. So colleagues will recall earlier in the year when we did the big refresh of the Constitution, we confirmed the definition for required training for governors, and in so doing actually reduced the burden in terms of the numbers of courses required, but also in making those courses easier to complete. Thank you very much to those that have already completed their training course. If you have done the course but haven't yet, let us know. Please do so ASAP, as we will need to take the next steps with that to ensure full compliance as we go forward. So other than that, I wasn't going to draw out anything in particular from the reports. Krishni, I would of course note that appended to the report, we've included the details of the priorities and the annual work plan as usual. So happy to take any questions or comments from council members. Thank you.
Thank you very much, Richard. I wonder if it's worth just getting a couple of the colleagues, or at least one of the colleagues who was involved in the Youth Advisory Board conversation, to just make some comment about that, because I know Joanne very helpfully updated me on some feedback on that. I think David was involved in that as well. So I just thought, it sounded like it had been a really positive session. So I just wonder if either of you would like to make a comment on that. I don't know who else was involved, but either David or Joanne, would you like to come in? Joanne?
Yeah. If you would like me just to start and just to share with you that the most surprising thing that I learnt in terms of when we attended the advisory board and spoke to the young people was that David is very well connected with the members of JLS. David, do you want to share?
Yeah, but how many people know what JLS is? There's a lot of blank faces. It's
sadly I do, David. At least I know of them, but that's about it.
If you're watching breakfast television on BBC yesterday, you would have seen Orishe Williams, who's one of the founders of the JLS band. He was talking about being a young carer himself before he became a band member. And I've been working with him as I helped him to get recognised as a Commonwealth champion for young carers. And I've done various things with him. He also got me to go to his concert with my grandchildren, which was great fun just before Christmas in Newcastle. But he's very passionate about young carers, and one of the things we talked about. I was surprised that the young people actually did know JLS, because they are actually now a bit beyond the current generation, but they were enthusiastic. So I'll try and see if we can get him to meet them online. But they were a very enthusiastic group. I don't think that was only because they were ready for pizzas, which were delivered after the meeting and eagerly devoured. Not by governors, I should say, but it was they were a very enthusiastic group of young people, some of whom are going into careers in the NHS, some of whom are users of services. And we had an interesting conversation, and they've been involved already in doing a number of things, of course. So strengthening the connections, Joanne. And there was a third governor with us as well. Not sure if she's on at the moment.
No,
Okay.
she's not here. No, and just to say, there was an appetite by a couple of the young people to be a young governor on NHFT, so they were interested. So that was really positive.
Brilliant. I mean, it sounded like a really good opportunity, and I'm really glad that you were able to take advantage of it. And of course, you know, that's very much in line with the priorities that the membership and representation group agreed for the Council of Governors. So really positive to see that taking place. And I think also really good to hear that we had our most well attended, I think David touched on careers within the NHS, and indeed there's also really positive feedback, I think, on the webinar that took place about careers in the NHS. And again, I don't know whether any governor here attended that and who's got a reflection on that, because it sounds like it was a really positive event. Unfortunately, I don't think we've got Roshni here, have we? Because I think she was particularly involved in that. Joanne?
Yeah, so I did attend, and it was a really well attended session, and it really did showcase 360 degrees of all the sort of careers that there are in the NHS, which was really beneficial, and the case studies were really good. So it was, yeah, really good is all I can say.
Great, thank you very much. So really good to have some feedback from colleagues who were involved in those sessions and items, and I think you know, good to have all of that sort of captured in your report, Richard, so that we've got a record of them. So the paper is really just there for information and for noting, and particularly for the whole of the council to be cited on these various activities that individual governors on behalf of the council clearly are undertaking. So thank you very much for everyone who contributed that, and indeed Richard for the report. So moving on then to the next item, I'm really pleased that we have in our series now of really hearing from various governors. I think we've had a series now most recently from our partner governors. I'm really delighted that Sue Watts from Age UK, our partner governor who works for Age UK, is going to do our partner governor story. So Sue, I think it's just over to you.
Lovely, thank you very much, Krishni, and good afternoon, everybody. Joanne, have you got the first slide? Brilliant, thank you. I just want to start with a brief overview of Age UK Northamptonshire. Not a lot of people know, they know our name, they don't know what we do. And even Krishni has just referred to us as Age UK. We're not. We're Age UK Northamptonshire. We are a completely autonomous charity. We share a name with the National Age UK, but that is it. And we stress that over and over again because we are not the same. We're not the same organisation. We are a fairly large voluntary organisation within Northamptonshire. We work county-wide, and we've been in existence for well over 70 years. I think we were actually born from one of the world wars when it was the Older People's Welfare Committee, and it's expanded and grown from them. We have around about 160 salaried staff, Most of them are part-time, but we do have full-time staff as well. We also have about 75 domestic care workers in the community and around 30 casual workers that work over lots of different services. We have an annual income of round about £4.5 million, and I think I've been with Age UK Northamptonshire for nearly 24 years, so I've seen lots of different changes. I've seen it grown and grown and grown, and I think we've been quite canny with our finances. We didn't want to put all our eggs in one basket, and that £4.5 million is now made up of approximately a third of that income comes from our charged for services. Round about a third comes from our contracts with the NHS, with social care, with other big partners, and around about a third comes from unrestricted income. So that's the money we earn from our trading, our products and everything, the trusts and grants if we can get some money for those, and our own fundraising that we do, and particularly from our 8 shops that we have over the county. People sometimes find it hard to understand why some of our services are free to clients and some we make a charge for, but that depends purely on where the funding for those services come from. If we have no funding, we have to charge for them. Can I have the next slide, please, Joanne? This last year, we've supported it's nearly 18,200 individual clients in the last year. That included 8,000 brand new clients, and that is a huge amount. The increased demand has come from obviously the pandemic, the cost of living crisis, and it's the biggest amount of people that we have dealt with, and that demand keeps on increasing. I'm not going to go into a huge amount of detail about all the services, but I'll just very briefly run through them so you can see what sort of things we're doing. We do a lot of collaborative care work in the community. That is very much about interagency working and keeping people out of hospital before they hit crisis. We help with holistic assessments of those people, frailty assessments, and do monitoring calls. A lot of our services are monitoring, trying to prevent people from deteriorating and picking up when they do deteriorate and before they go into crisis. We have quite a large end of life service, which people don't realise at all. We're contracted by Marie Curie. It's a 24-hour-a-day service. We do night sits 7 days a week, 365 days a year. Marie Curie look after the clinical side, the medical side, keeping people pain-free. We do all the other stuff, the night sits, the making sure the families are okay, anything that needs doing to enable that person to stay at home and to die if that is where they wish to die. We do hospital discharge services. We work with both Kettering General Hospital and Northampton General Hospital. We have 2 lots of different social prescribers, one through the primary care networks and one through the Spring project, which is a 5-year project. And we're also along with Northamptonshire Carers, one of the founders of the Age Well project, working with NHFT on that. We have been for quite a few years, and that's been very successful. So those ones are the ones that are funded by the NHS. Information and advice is a huge part of what we do, a huge part. People come to us because they're struggling with money, they don't know where to go, they're in dire straits. We will do benefits assessment, help with benefits claims, and in a typical year we get about £3 million in unclaimed benefits back for older people. That's not only good for older people because it helps them to stay independent by buying in the help they need to be independent, but it goes back into Northamptonshire's economy as well. And that is a completely free service for older people. It is a core service we don't receive a penny for. If we're lucky, we get a little donation from the people when they get a big backlog of money coming to them, but that doesn't happen very often. We have a money management and support service. which helps people to look after their money if they can no longer do it themselves. We deal with their direct debits, we deal with hoarders, sorting out all their bills and everything. We have a new appointeeship service. We've now set up a trust corporation so we can do that, and we're working quite closely with both the unitary councils and their social workers to deal with a lot of their clients, and that is really taking off. The charge for services are our domestic care service, which is a huge cleaning service basically all over Northamptonshire. We do still do daycare, but we now only provide it from 2 locations. One is, excuse me if you can hear my landline ringing now, sorry, but daycare now is from the Baptist Church in Rockingham Road in Kettering and from our head office, the Venton Centre in Northampton. But we also now have quite a thriving care support at home service, and that was born out of the pandemic. People still wanted what daycare offered, but did not have the confidence anymore to go into a venue with other people. So we do a bespoke care support at home. They get exactly the same sort of things that they got in a day centre, but they get it in their own home. They can have it for as long as they want and for as many days as they want. Sorry, I'm really sorry about that. I don't know if you can hear it in the background. My Alexa's going mad. Good, I'm glad you can't. That's okay. Foot care, it's not a foot care service, it's a toenail cutting service. And again, we go into people's homes, cut their nails when they no longer can. And that's a really big service now. And handy persons and the gardening service, making sure people can still stay at home. I'm really sorry, I'm just going to have to do something with that Alexa. Can you just excuse me for 1 second, please? Sorry about that, it's gone. So handy persons, we fit light bulbs, we fit stair rails, we do anything to adapt a person's home to make sure they're safe. There is no charge for labour, it's only the things that need installing in homes. And at the moment we have a tiny amount of funding to do some home energy checks for people and fit insulation and energy efficiency devices for them. We do telephone befriending, which is a large service. We do have our own transport, so we transport people to and from venues. And spring is part of the social prescribing, and we set up lots of activity groups for people with long-term mental health problems. One of our newest services is community responders, which is a partnership pilot. There's a soft launch on the 12th of January, and this is based very much on the first responders for the NHS with the paramedics. This is community responders for social care. If there's older people who've had a fall, they're waiting for a nurse, they're on the floor, they need their family can't get there for a couple of hours or something, we're going to have volunteers. We're recruiting volunteers to go out and do that. It is part of integrated care system, and as I said, it starts next Friday as a soft launch, but we have really high hopes for that. Next slide, please, Joanne. This is, obviously about partnership. I just wanted to show just some of the people that we do work with at the moment. A lot of our work is about partnership. None of us can do it all on our own. We all need to work with everybody else to make a difference to the population. But obviously, I've mentioned the hospitals, the councils, NHFT, Marie Curie, the Voluntary Sector Assembly, which is growing and thriving, and Chris Duff, our Chief Exec, he heads the older persons thematic group within that. And they've just written a very comprehensive older people's report for Northamptonshire, which is being circulated around as many people as we can get it around, basically. We've done a lot and continue to work with the University of Northampton and Health Watch. And we also work with businesses within the town, particularly for fundraising and trying to be Charity of the Year and raise raise the impact of what we do and the need for what we do. Although I said we don't do a lot with Age UK, obviously we do work with Age UK, we do have a relationship with them and we adhere to their standards, and we're also part of the Carers Partnership. Next slide please, Joanne. And I just wanted to put a little bit about quality, because quality is so important when you want to work with partners, when you want to be commissioned, when you want to be funded, particularly when we're working with statutory organisations. And sometimes I think we have to work even harder at our quality assurance than statutory organisations, because you get us to tick a lot of boxes. But I'm responsible for quality within our organisation. I make sure our ISO 9001 is completed and kept up to date. I do the NHS toolkit every year, make sure that's all up to date. All our information governance. We are CQC registered because obviously we provide end of life services. So we do have the inspections, we do have reports. And I have to make sure absolutely everything is spot on and up to date if I want to continue to try and win contracts and funding from people. We also have to adhere to quality standards within Age UK. Although we don't receive money from them, we do share a name, and we have to make sure that obviously we don't do anything that could bring that name into disrepute at all. So quality for me is a huge part of the work that we actually do. And next slide please. Just want to mention some of the work that we have done or will be doing with NHFT, for people who don't know. We've done quite a lot a year with quite a lot of work with fourth year medical students with NHFT, and this was from, I think, Leicester hospitals, the teaching hospitals there. They asked us to host some fourth year medical students to give them a taste of what goes on in the community, so they get a feel of, you know, if they do discharge older people, what they are going home into, the sort of services are out there. And we know for doctors there's such a lot out there. Once they're trained, once they're discharging, once they're actually prescribing and everything, they can't possibly know everything. But it's about trying to figure out, and yeah, they've even done some home visits with us to older people that have been discharged, to see what older people can sometimes be up against, and I think they've found it quite eye-opening. I've had so many visits to HMP, the prison at Little Hay in Huntingdon. They now have a huge population of older men within that prison, and we are trying to figure out together what we could do to help them to improve things within Little Hay for those people over the age of over 60, basically. There is so much that could be done, but it's finding the appropriate funding to do it. But even just before Christmas, I had another email about please, 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 you know, we would really like your help with that. Occupational therapists, we have received training on low level equipment and everything, how to prescribe, how to install and everything. A lot of the people we work with don't need the high end equipment, they need low level equipment to keep them safe at home, and yet the waiting list can be so long that other people need to be able to fit and source those pieces of equipment as well. And one thing we've been doing over the last, I think it's 2.5, 3 years now, is a really excellent leadership programme, which has been developed and run by NHFT. For the first 18 months, we did it with all our senior management team. And over the last 12 months, we've done another leadership programme for our middle management, which has gone down so well. And we have a meeting next week actually to figure out what we can do in the future, because it's been so well received that we really want to carry on. And again, knowing how you work, how you train your staff, helps us to have the same sort of input with our staff, which again stands us in good stead, but actually doing partnership work with you and for other statutory organisations. So the last slide, please, Joanne. integrated working, I just wanted to do a bit about not just Age UK, but the actual wider voluntary sector and the added value of working in partnership with our sector. I think we all identify risks and provide wraparound services to mitigate those risks. And we always, all of us, involve other organisations. If signposted is needed, we know where to go. We work so closely together within the voluntary sector. We all prevent ill health by increasing the levels of healthy ageing for older people, keeping people fit, well and active. We improve well-being. We hopefully reduce the need for costly health and social care services, such as unnecessary hospital admissions and readmissions. We prevent and reduce loneliness and isolation. We have a positive impact on people's health, their well-being, and their sense of community. And I think we are solution providers. That's what we actually do. We don't always want, sometimes people refer people to us because they think they know what's best for them. We say, don't do that, just refer somebody to us. We'll work it out. We'll see what's the best for them. You know, and I think that's what the voluntary sector excels at, actually. We provide those solutions to them. Right, and now it's the last slide, I think, Joanne. So I think we were asked, and I know this is what Mark did on his, and I thought I liked this. I wanted to do the same here. What I find most satisfying about being part of the voluntary sector, and particularly Age UK, it is that positive impact on older people's health and well-being. The fact we do provide really high quality services, we pride ourselves on that. We are solution focused. We can give a very quick response. I always say to people when they join Age UK, don't think of us as an easy option for working. We have our own red tape, but we're quicker to react. We give people permission to try something and to fail, rather than, we know in some statutory organisations you go through 17 people before you get okay, have a go at doing that. We can give a quick response, and we do add social value. The most challenging things for me are the funding. Our name, once again, can get in the way of funding because people think they're going to be funding a national organisation rather than a local organisation. And a few years ago, I even wrote when it was a daily Evening Telegraph, just sounding out about that and saying, we are as local as anybody else in this county. We just share a name. The funding, contracts are always short term. The fact, I know Mark Major from Carers will recognise this. We haven't had uplifts in any of our contracts for years and years, even though obviously the national living wage has gone up every year. Inflation rises. We do not get those uplifts, or very, very rarely. Recognising priorities can be very hard. We so want to be reactive rather than always proactive, but funding has a bearing on that. We know what the need is out there. We know what we would like to provide, but if we can't find the funding for that, it's very, very challenging to try and create a new service. We all of a sudden have to chase the money where it comes from. It could be something we've never thought about doing before, but if somebody approaches us with an amount of money and says, could you provide that? We have to jump to it basically and try and provide it. But that can be challenging when you write a strategy for the next 5 years and you want to deliver it, but finding that funding is increasingly hard. So that's it from me. Thank you very much, Krishni.
Really illuminating. Thank you so much, Sue. I wonder if there are any questions or comments. Mark Majors commented, really good presentation, many thanks. Great set of services and great advert both for the voluntary sector and for partnership and integrated working, which I think sums it up sums that up really well. But I thought that there would be some questions. They are from non-executive directors, so I would encourage governors, if they would like to raise any questions as well, to please do come in. In fact, I think as Joanne's hand has gone up, I'm going to ask Joanne to come in first. So Joanne.
Yeah, I just want to feedback and say thank you, Sue, for that excellent presentation. And just to pull out that pink section about the social prescribers, about Marie Curie nurses, you know, the age well. Yeah, I've on my caseload, I've got people who are engaging in all those with all those agencies. Yeah, so just to say you're visible out there to me. I'm seeing the fruits of you know, the hard work. So thanks very much.
Lovely, thanks, Jo.
Thank you very much. Yeah, lots of nice comments coming in, Sue, in the chat. Very impressive insight on the breadth of services provided, and really enlightening what a variety of services you offer that have such a positive impact for older people. So really, I think people really enjoying hearing about those range of services. So the number of people wanting to ask questions or make comments has gone up a little bit. So starting first with Saqib, then please.
Yeah, hi Sue, thank you for that presentation. And I had no idea of the range of services whilst I was aware of AGK. I don't actually live in Northamptonshire, so I'm in Bedfordshire, but I think my mother, who will turn 75 this year, I think will potentially benefit from some of the types of services that I'm sure will be potentially available through AGK in Bedfordshire as well. So thank you for your presentation, and carry on the great work that you do for everyone in the community. And obviously in different towns, there will be different ethnic minorities that also, perhaps sometimes feel left out. So I know my mum's involved with some groups that focus on people, say, from the Indian community, but nonetheless, I think reaching out to everybody, they're all at similar stages of life and they have similar challenges. So thank you.
Thank you.
Thank you, Saqib. Joanne?
Thanks. Yeah, thanks, Sue. That was really great. I had an inkling that your reach was quite extraordinary. You've just confirmed it. So I've got loads of questions, but I'm just going to limit myself to two. So the first one is around the preventative work that AGK Northants do. And I think one of the things that I'm really keen that we maybe start thinking about is how do you think we can capture some of the evidence that you have from the closeness of your work with communities, which we can help you to support in informing the commissioners about services? And then the second one is another how question, which is funding aside, and if I was the sort to run marathons, I'd wear one of your vests, but funding aside, how when we work as NHFT, is there anything that we do that negatively impacts on your position, apart from that sort of short-term funding issue and the uncertainty?
No, I mean, to answer your first bit, Jo, we have so much evidence, we really do. We collect everything that we can, because that is the only way sometimes we can get through to other organisations about what we do and everything.
Yes.
We are devising a new client satisfaction survey at the moment as well, because we don't. I think sometimes we're guilty in a way. We're our own worst enemy. Our staff sometimes don't realise how good they are. They don't realise the impact they're having on staff, because it's part of their day job. It's just what they do, and it sometimes takes other people to say, actually, you went so much above and beyond to actually make a difference to that person, that they don't realise that we are trying to get staff to capture much more, many more case studies and everything. So I think that's the most powerful thing, rather than numbers. I can give you numbers till I'm blue in the face on, what we've done, but that is what we're trying to do at the moment. As for NHFT, yes, obviously, yes, the contracts and everything are hard. Sometimes the only negative thing I can say is sometimes it's hard to pinpoint the right person to go and talk to within NHFT.
So that's sort of navigating the organisation.
Absolutely,
right,
absolutely. Okay. You know, as in all organisations, people do move around, have different positions and everything, and you do build up And I wouldn't say NHFT is probably the better of the statutory organisations within Northamptonshire, whereas relationships do tend to be a little bit more stable, but it's still hard if you've got an idea or you want to talk to somebody to get to the right person. That is my job, and I find that a little bit difficult sometimes, Joanne.
Okay, that's really helpful. Thanks, Sue. Thank you.
Okay.
Thank you very much, Joanne, for those questions. So we have some of the people who might respond to that point that you just raised, Sue, wanting to come in. So first of all, Linda, as our chief nurse, Linda.
Thanks, Krishni. Thank you very much, Sue, for that presentation. Just confirming the work that Age Concern is doing, and that's a breadth of wide-ranging services, and really important because you touched on the aspect of how lonely it can be for older people. So really happy to hear the work that's being done. I just wanted to mention to you that I would like to connect with you outside of the meeting. You spoke about the work to do with older people in HMP Little Hay. So yeah. I'm the exec director link for HMP Little Hay. So I'd be really happy to connect with you, and then we can look into that, because the prison population, it is difficult. And actually the setting you've mentioned, we do have more older people who are there, and we really need to try and support them whilst they're there. So I'll be happy to do that with you.
Brilliant. Thanks, Linda. We'll make sure that I think you'll probably be able to see from the links in the chat that Sue's contact details, but we can facilitate that for sure. So that's really good. David, Dave Mayer first, please.
Thanks, Christian. Thanks, Sue. That was hugely inspiring to see all the work that Age UK and Northamptonshire do. I just want to make a few comments, really. One, I guess, is Northamptonshire, would it be in a really difficult position with its population if we did not have organisations like Age UK Northamptonshire? The latest census, obviously, I think puts us as the highest growing population group over 65 nationally. So that puts stark relief onto some of your kind of funding queries, partnership queries, linkage queries. So I think the impetus on us is to engage with you on those proactively, as we've done through ICANN and Aging Well and so on. And I know Linda will pick those elements up with you. So just a commitment, really, that we could not do the work we do with our older population without you. And we send our thanks and assurances of ongoing support.
Lovely. Thank you, David.
Thanks, Dave. David?
Thank you. So for anybody who doesn't know me, I'm David Williams, the Group Director of Strategy and Partnerships. And I think, Sue, that point you raised earlier about who to contact is something that I think the NHS would also recognise about who to contact in voluntary organisations. And what I just wanted to let everybody know is that NHFT with LPT are one of 9 national provider collaborative innovators. And one of the things this has picked us up is that just before Christmas, NHS England let us know that they'd give us some additional funding in order to support greater engagement with voluntary and community sector. It's not a lot of money. And because it's not a lot of money, what I've started having some conversations with people about is how can we use it to have multiple conversations in order to try and help NHS managers understand voluntary and community groups, who's out there, and voluntary and community groups understand the NHS, to try and do exactly what you're saying, Sue, of breaking down those barriers, and then people know who to talk to. So that's something that over the next coming months we'll plan in and be able to take forward.
That's great. Thank you for your positive comments. Thank you.
So thank you so much. I mean, I think I've had the privilege of hearing from you and other colleagues before, but it's always good to get that refresher, and also to hear about the newer developments like the community responders, which I think sounds like a really great additional service, because I think there's been talk, hasn't there, about supporting people with falls, and you talked a lot about admission avoidance. Really everything we say about prevention, admission avoidance, the voluntary sector has a huge part to play in and needs to be seen, I think, as a really key partner in helping us to achieve the outcomes we collectively want to achieve. And I think what you've demonstrated, and previously Sharon and others have in their presentations, really demonstrated what value we get in our locality from our voluntary sector and indeed our other partners. So and there are some lessons, I think, like the try and fail, being willing to try things and sometimes it not working, as long as there's no harm in it. I think, there are things that we can learn. And I think your example of, NHFT sort of sharing leadership development training with you, but equally us learning from you on something else. I think these are all examples of really good benefits from partnership working, because we all get to understand each other a lot better the more we work together. So thank you so much. There's been really good feedback, Sue, on the presentation, as there was with other partners, so always good to hear. And I think some follow-up points, I will leave Linda to follow up with you, and indeed David. Money is always a helpful little additional thing that David mentioned that we may well be able to exploit. So thank you so much, Sue. And we will, I'll leave Richard and Tracy to think about whether, I don't know whether we've exhausted our selection of governors, that partner governors we were getting to present, because I think a lot of our partner governors have presented. There might be somebody outstanding, but otherwise we'll have to think of what comes next in our series. So watch out for the next edition of the governor story. So thank you again, Sue. Right, so moving on to the next item on our agenda. It was referenced a little bit in Richard's previous report, the Council of Governors Effectiveness Review, but we felt this justified really its own item. So I'll hand back to Richard to cover that off. Richard.
Thanks very much, Krishna. Yes, if I could draw colleagues' attention to paper E, which sets out the outcomes of the effectiveness review, the outcomes of the workshop that we have with a number of governors and NEDs to consider the findings and what action to take, and then sets out what action we've already taken, and equally seeks your approval for one of the changes that has come out of that workshop. So I suppose really not going through all of the detail, but the headline message I think coming out of the effectiveness review, which is of course a core part of our annual governance process each year for the council, is that we're doing pretty well, actually. Over 75% overall satisfaction score, and you can see from the appendix where we've summarised the responses to individual question that actually, in addition to the average being pretty strong, individual question responses were likewise strong. So thanks very much to those governors and NEDs that were involved in our workshop in November. We had the opportunity to reflect on what those results mean for the council over the coming months, and you'll see at the bottom of page 1 some of the ideas, suggestions and requests really that came out of that meeting. I want to draw in particular attention to the top of page 2 though, where we set out the 5 things that we've done or are proposing to do as a result of that. And I'll dwell really on the first one, which is the one in which we're seeking your approval. So one of the things we talked about was the relationship between the Board of Directors and the Council of Governors, and how that helps or hinders really governors in holding NEDs to account for the performance of the board. And as you know, currently the Council of Governors meets just before the Board of Directors, so the information that we're sharing with you is often 1 or 2 months old, because it's information that was presented to the last board meeting. So one of the things that was felt to be a potential improvement was actually to move the Council of Governors to take place after the Board of Directors. So actually you'd be getting a much more contemporaneous report from non-exec directors on a meeting that's only just happened, more contemporaneous performance information, for instance, and therefore better able to hold people to account and for that challenge, I guess, really to then influence action in a much more effective way. So what we've done is somewhat presumptively, admittedly, set some dates out in Appendix 2 of what that could look like, and we focused just on the Council of Governors meetings and the workshops here, but of course what we'll need to do then is to map in all of the other groups as well, such as the nominations meeting and the membership meeting as well, which will need to work in sync with these two the Council of Governors meetings in the new year. So I hope that that makes sense, and I would ask for your support really for that recommendation, so that we can then embed those dates into our corporate calendar, which will incidentally be published very shortly. So other things that you can see listed there, really that came out of that workshop were how we can further strengthen our training and development offer, which Christian alluded to was mentioned earlier on in the Corporate Governance Director's report. And we've already taken some action on this, how we can bring to light more some of the information about how the Trust is doing in terms of its performance. And indeed, we've used both a combination of the net assurance item and some of our workshop time really to illuminate perhaps more clearly than we've done in the past for governors how the Trust is doing on some of the key performance indicators and other areas. So in the interest of time, I'll stop talking there because the rest of the information's obviously written in the report. I'll clearly take any questions you may have about the effectiveness review, the actions that we've proposed to take, and then we'll seek your agreement to the proposed change to meeting dates into the next year. Thanks very much.
Thank you very much, Richard. I think there's a question or comment from David, please. David Jones.
One of the many Davids. Yes, thank you very much for the helpful report. 2 points from me. The first one, I support the arrangements for scheduling the various meetings. However, just to be clear so that we understand, this means that we are not proactively seeking to influence decisions, but we are checking how decisions have been made. Actually, that's not quite true because we can do both. But the main emphasis of the timing is that we are checking that the non-execs and the board, how they have taken decisions and how they are implemented and whether the right information has been gathered. There is a way in which we can influence things, but that is much more difficult. Inevitably, organisationally, it is more difficult to influence things, but we have been able to do it in small ways. But I think I'm being clear, but tell me if you think I'm really wrong, that this is fulfilling our function of checking that when decisions have been made, they have been taken properly. And that may be for some governors not what they expected. I mean, some people might expect that being a governor means you can shape the way things forward, and that's the emphasis. And I think that was important from the workshop this morning, the earlier workshop as well. What are the expectations of governors? What would the CQC expect us to be able to talk about? That might be something I've got wrong, so please correct me if I've got that wrong. The second point, just to put them both together, is that the lowest score was I think was around. Well, there's one low score I'll pass over, but the next lowest score was around representation. And as the governor that is supposed to represent Northampton, I constantly struggle with this. If CQC said to me, how do you find out what the people of Northampton think? How do you make sure that the trust is informed about it? I couldn't give an answer, except by saying I talk to my friends. I sometimes look at the local paper. There is a membership scheme, but membership is a very odd thing. Most people in the country don't know that they can be a member of the NHS. They think they are anyway, because they own it. Why do we need it? And I struggle with this sort of structural question. So before the CQC comes, I would like to have a clearer understanding of how the trust can help me to understand what the public in Northampton expects of us and what their feedback is. And of course, that's many layered. And I know that the Trust is very good at least taking views from patients and taking views from people who've used services, but that's not my function. And I just raise that as a dilemma, and I know other governors have discussed that as a dilemma, those of us who represent the public. And again, you know, if I'm misunderstanding it, please correct me and help me to feel more positive. But I'm just raising those 2 points. Thank you very much, Krishni, and thanks, Richard, for the presentation and the paper.
Thank you, David. Richard, do you want to comment briefly on either of those points? I may well want to kind of make a couple of comments myself, but I'll let you start.
Yes, of course. No, really helpful on your holding to account points, David. As you say, it is possible for governors to do both, and certainly the workshop that we've got coming up in terms of the engagement with us on the trust strategy and plans is one really good example where governors can then influence the decision before it's made. But equally, as you say, that sort of primary role of, okay, this is what happened at the board meeting, let's really then hold the NEDs to account for what was happening is very much more the sort of substantive role of governors as you described. So hopefully with that proposed change, that will make that a bit easier for governors. And I think you're right actually to point out the challenge with membership engagement and representation, and indeed with the membership priorities. One of the central parts of what we've tried to do over the last year, and we've had some success with this, is actually just to build the infrastructure to enable us to do some of those things. So as you say, in the first instance, we've moved from, as I think Chris Davison used to describe, as just a list of email addresses really, to a database that now allows us to segment our population and understand, well, who is it that has signed up to be a member in Northampton. What we're now moving on to then doing is using some of that technology to then say, well, let's elicit views from them. And now that we're sort of post-COVID recovery, getting out and about, we should be then doing some more of that engagement work where you are able to get out into the community, listen to views. What I would say, though, is that there isn't necessarily a heroic expectation for you to hold constituency surgeries and so forth and do lots of things. So as you say, I wouldn't feel at all embarrassed about, well, I'm just talking to friends in my network. That's exactly almost what we'd expect you to be doing. And we should then be supplementing that with some of the things like the member webinars, where we're actually building that connection for you with members of the community. And what we want to do really is, rather than doing that sort of generically across the piece, is to use then our sort of north and west constituency meetings to bring that a bit closer to home for people. One of the other things I wanted to mention, without wishing to go on endlessly on the topic, is also the connection with local area partnerships that we've broken, certainly in the north of the county, bringing those governors in contact with organisations such as SUS, for example, in the voluntary sector, but also local people, local councillors, from which you can elicit that sort of independent view rather than the trust telling you, well, this is what people in Northampton think. Actually, that gives you a sort of an independent mechanism to then say, well, actually, I heard from an organisation that works with NHFT about their experience. So those are some of the things that I'd offer, but I recognise the challenge that you've described. I wouldn't in any sense say that we've conquered it, and indeed I'd say that we're not dissimilar from other organisations that are grappling with the same thing actually. So much more to do, and I think through the membership group is definitely something we will pursue together over the coming year. Thank you.
Yeah, thanks, Richard. I was just wrapping up, seeing Councillor Matt Golby there on the call. That's, and also, as you rightly said, that's an important link for representation. Councillors are elected, and making sure that feeds through, and perhaps more effectively connecting between between us on that front would be helpful. Just saying that I'm coming to the end of my term, so perhaps seeing through some of these things isn't an issue for me anyway. We'll see what happens, but thank you very much.
Thank you, David. I mean, I think you make it's a difficult. I think it is a difficult ask of governors, actually, to be fair, and I think we've always recognised that. It's you know, it's almost like undertaking a counsellor role without having any of the sort of structure that supports that. But I do think, I mean, Tracy's made a really important point in the chat about, you know, actually therefore what's realistic for governors to do, and I think that's about much more about using your networks, whether it's JLS or you know, your connections, your networks, your your relationships, to understand, what issues people are talking about in your local patch. I think all of that is perfectly legitimate, and genuinely, I don't think there's an expectation that people will be able to do more than that. Having said that, we can be smarter at that, and I think that's where some of the work we've been doing, and not even the connection you've made with the Youth Advisory Board or other things like that. I think all our ways of constituency meetings, Richard's mentioned, that the event that's coming up, all of that is very much about how do we just try and make sure we create enough mechanisms for these things to happen. So I think, there have been some really good examples of ways in which governors have connected, and we just need to keep flushing out those examples and creating more. The school connection was a good one, wasn't it, that Helen, I think, made previously before she stepped down. So so something we need to keep working at, and I think that's the journey that we're going on, really. But I think many governors have certainly used their connections really, really well. And I would support Richard's point. I think that we should be able to do both. I think one of the issues we've got currently with the timing is some of the information we share with you is a bit out of date. And if we plonk it a little bit, plonk is not a technical term, but we organise it a little bit more in a timely way, then I think we can potentially share things with you in a little bit more of a timely way as well. So it should allow us to do both, in my view. So we'll have a sense of what's coming up on the board agenda, but also what's been discussed after a board meeting. So hopefully I'll tick both of those boxes. So if there are no further questions, are governors happy to support the proposals that the corporate governance team have set out in the paper, and in particular to change the timings in the way we've described? And there are a number of other bullet points. So really just looking for your support to go forward on that basis. Everyone happy to do that? Great. Thank you very much. And thank you for the comments, and Richard particularly for the overview. Okay, we move on then to the reports of the Chair and Chief Executive. So we do have the reports from our last board available for you, but for reasons we've touched on, they are somewhat now sort of behind the times. So actually what I'd like to do is particularly to invite Dave Mayer to really perhaps tell us a bit more currently what's on the top of his agenda, gives a flavour of the things that Dave is dealing with. And of course, any member of the council is very welcome to ask any questions about the content of the reports, which are paper F and paper G, which are available to you that went to the board. So I'll come back to that if people want to raise any of those questions, but I'll hand over to Dave. Dave.
Thanks, Christian. Happy New Year again, colleagues. It's really nice to see people on a full spectrum, a full screen, as Christian said. I won't go into the report. Just one thing to draw out. Colleagues will note that I attended Wellbeing Board, particularly Matt's Health and Wellbeing Board, and the local area partnerships are doing really great work. Richard referenced it in the response back to you, David, and I just think there's probably something emerging there as a really helpful framework for engaging communities at a really place level, and governors could get involved in that as they mature. I think that's probably quite sensible, and a sensible use of public resources more generally, because they are being resourced to do exactly that work, which is engage with communities about the things they want to see from their public services. So they're there, so let's try and introduce you to them and maybe introduce them to you. In terms of on my list, I guess it's probably three things. If I just cover operationally, which colleagues will be obviously keen to know, we're in the middle of the second strike during what is, I suppose, the holiday season. Fairly fair to say, I think that the first strike in December was, we managed to mitigate that through our actions. Currently, we had the strike begin yesterday, the 6th day, the longer strike begin yesterday. Current evidence is that our planning is working. We had all kind of rota shifts filled by Sunday evening, and we feel pretty confident looking ahead that we're in a pretty good place. And I have to say that is largely down to the teamwork and spirit of colleagues across the trust who've approached this in such a collegiate, strong leadership way. You know, from Itai, Chris, who's chaired the strike group for must be going on for over a year now, Chris. We must be hitting at least 52 separate meetings of people coming together to work through the detail of this and operationally then deploy it through AND services. So just really want to extend that thanks and through those individuals out to the rest of the organisation across all exec colleagues, because it has been a monumental achievement. If you think how many strikes we've had, how long they've been going on, right through from nursing to this point, it's been very challenging. Correspondingly, I guess we're in the middle of the peak COVID flu season, and unfortunately our data is no longer, the data we get supplied nationally is no longer really giving us a clear picture of that. So for example, the current data says that there have been 3 episodes of COVID in my local parish. I know of 5. So that's an indication that the reporting is not really up to date or actually telling us what we need to see. So we are seeing increased levels of staff sickness, certainly within our acute colleagues. Our numbers remain reasonably stable, but we have had outbreaks on wards. So that continues to be a live issue for us, because of course it does mean we have to shut wards. It remains a notifiable disease, and we have to put IPC measures in place, and all of that has corresponding impact on service pressures and waiting times. So just want to keep that alive, because sometimes we don't talk about COVID anymore, but actually it is still a live issue. So I just want to remind people of that. And then in terms of the staff wellbeing overall, that remains a key focus for us. And I know Julie Shepherd in her new role is going to help us through our wellbeing group look at some of quality improvement initiatives, particularly around burnout, to make sure that we keep staff front and centre to our minds, along with patients, of course, but critically, happy staff equal happy patients. So we have to get that right and keep a continuous focus on it. And on that note, it is with great pride, I think, that the Trust has achieved, I think, a record result, Chris, of well over 60% of colleagues participating in the National Staff Survey. And that's really important for 2 reasons. One, it gives us a real sense of where people are at, where we could do better for them. And then secondly, it gives us really great evidence to use in recruitment to attract people to the organisation. So I used the staff survey when I applied here. It was one of the reasons I applied to the Trust, and that will be true of many others. So it's a really important tool for us. So we're really excited to get that wealth of what will be reasonably empirical data, we think. The second thing playing on our minds is finances, of course, and we did look to reset our finance plan back in November, which was a national request, where we were seeking to deliver above the £15 million that we delivered this year, or will deliver in this year, a further £4 million over Q4. That's work that we're currently undertaking. We've got plans in place. I feel pretty confident about our original plan, and I feel broadly confident that we're in a good position to support further efficiencies over the course of the year. That then brings us into next year's planning, which we have yet to receive the guidance for. We expected it in December. So we don't quite know the shape of that guidance, but we know the general shape of the finance picture in Northamptonshire, and it remains challenging, as it does across most of the NHS. So we will have a very strong, robust value programme going into next year, making sure that we get best value for taxpayers and for our patients. And that will involve us making some choices about how we organise ourselves as an organisation to deliver those, so that we do get that best value. So we'll keep you updated through these fora and through the board of directors, of course. The final bit I just wanted to finish on really was the equalities duty, which is now a live expectation for trusts in their annual report. And I just wanted to flag that here because I think it's really important, and it links to Sue's presentation around social value and tackling inequalities, really. And that will give us, for the first time, a real good sense of the areas that are important that we can count in terms of how we're tackling inequalities locally. And that will be a formal reporting requirement through the annual report for 23-24 and onward. So that's really exciting for a number of reasons, as I've said. And you'll note in the report the social value charter was launched across the group, the LPT and ourselves, led by David Williams' team. And again, that gives us a really strong framework to begin to think about inequalities more generally. And that would be a really, really big focus for us next year, along with productivity and value. So that's all I wanted to say, Krishni, just to wish colleagues Happy New Year again, and yeah, onwards and upwards.
Thank you, Dave. And we have got a little bit more on finance coming up, because our topic from non-exec directors today is also on finance, because it's obviously a key focus for everybody, but not to say that, you know, that amongst the many, because it's really important to always say that quality and safety remains, you know, primary and at the heart of everything we do, as we've always said in our strategic approach. But yeah, really, it was really pleasing to see the staff survey response rate. Chris, I think probably, I can't think it ever going over 60 before, or hitting 60 before.
That's the
right?
highest, Krishni. That's the highest.
Yeah.
So
yeah, so really positive to get that. I'm not sure. I think we won't, you know, we won't know until all the analysis of the results, etc., have been done. But it's always a good indicator when people do take the time to actually respond and give us the feedback, and obviously we will look to share the full results with you in due course when they're available. So are there any questions or comments that anyone would like to raise about anything that Dave has mentioned, or anything in either the Chair or Chief Executive's report that caught your eye? Everyone quite happy with what they've heard and got a good sense of where we are? Okay, so I think that's all. I'd like to pause in case somebody wants to come in. David, I can see has put his hand up, and I don't know whether I also heard Joanne, but David first.
Krishni, subject to your guidance, I think we should propose a recognition of the pressures that managers and staff are under, and make some formal resolution about that. I'd be very happy to be guided by you or David or Dave Mayer about how we frame it, but something to express thanks to staff for the management response to the strikes and the current pressures. I don't think we should get into commenting on those in any way, but to recognise the work that has been done and the collegiate approach which Dave talked about. I'd be guided by you if that's acceptable.
Absolutely, David, it is acceptable, and I certainly think we can record it. I think we can share it at the board meeting, which is obviously also reinforces that the council were keen to do that. And Dave, I wonder whether, you know, there's probably some sort of trust-wide comms likely to go out in due course, and we could also perhaps say share a message on behalf of the council and the board of directors, thanking colleagues. Would that be possible, do you think?
Well, first of all, thank you, David. You know, that's a nice compassionate gesture, and for sure we will do that. We do it anyway routinely, and of course they're ongoing, the strikes, so there is no current end point, but the gesture is really welcome, and we'll have a think about how to do that appropriately.
Thank you. And in the meantime, David, I think we can absolutely record that resolution in our minutes of the meeting, and we'll certainly share it, as I say, at the board of directors, that the council explicitly wanted to record their thanks, and we'll think further about how we might share that message more widely. Is that okay? Thank you, David. Great. Did anyone else want to come in? Joanne, did you want to come in?
It was just to encourage people to watch the videos for the that were mentioned in the chief exec's paper regarding the development of children's services. And I think, you know, if we just come back to about holding to account and those conversations that we had sort of as we were coming out of COVID, just to say it's really encouraging to watch, you know, engagement that is taking place and how services are being developed. So I just wanted to be positive about that, having watched them.
Great, thank you, Joanne, and it's great to know that you've observed those videos because they are very useful, that illustrations of things that are developing, which is really worth noting, so thank you. So thank you, Dave. I think we are just asked to note the update and report. We will move on then to our non-executive director risk and assurance topic. As I referenced, we thought it was important just to add a bit of perspective from our non-executive directors on our finance position, because it has been a topic of conversation, as you would expect, in the board of directors. So over to, I think, Judith and Saqib, who are jointly sharing this. So over to you.
Thanks, Krishni. I believe, Happy New Year, everybody. I know you've heard it 16 million times already, and it's only the 4th of January, but it is the first time I'm speaking today. Saqib and I will be jointly presenting to you, and I believe Saqib's going to start. So over to you, Saqib.
Yeah, am I sharing my screen? Okay, great, brilliant, thank you. Obviously everyone's hears about the finances. We know that nationally we're under pressure, and some of you may be aware that there was a letter written in November actually, to all NHS organisations in the country and cascaded through the ICBs in trying to deal with the financial pressures they are under. As you'll see over the next few slides, you'll see where we're at, how we're dealing with it, what has driven some of these issues. And what I would like to give you assurances, obviously as an accountant myself of 30 years, then both through the Performance Committee, through the Integrated Assurance Committee, through the Audit and Governance Committee, and through the board meetings, we regularly review our financial position and associated matters. So on to the next slide, please. So NHFT, as you can see, roughly receives 17% of the 1.3 billion that comes to Northamptonshire through the ICB, the system known as the Integrated Care System. And of that, we get 220 million. Through other sources, we get an additional 86 million, such as local authorities and NHS England. So collectively, our budget is 337 million. And correct me, I've forgotten the exact number of our headcount. Is that about 4,500 people? Don't know, there or thereabouts.
Yeah, it's thereabouts. Yeah.
Yeah. So it just gives you an idea of the scale of our organisation. So on the left-hand side, you can see how the budget is allocated. So the largest amount in nearly every patch throughout the country will go into the acute services. So this is like your A&Es, inpatient, outpatient activities. But then you can also see, obviously, mental health and community health that we're involved with, and then other services. Then they get the balance of that allocation. So in our budgeting for the year, we obviously factor in what's happening, what our pressures are, etc. And one of those, for example, is that we have inflation on the national tariff, and that was done earlier on in the year. We also have patient needs. So, for example, what the situation was post-COVID, and then equally what is happening as a result of those things. So, for example, post-COVID, during COVID, there was a lot of mental health demands, mental well-being from, for example, children. There were people that weren't in their workplace. There were a whole host of different demands that would have been seen during 2020 to 2022, but obviously because of the NHS focusing on the COVID response, then these were not seen at the time manner that they would have been. And obviously everyone's heard of the 7.8 million people now that are on a waiting list that will potentially be seen over the next 5-6 years. And that obviously that list is growing because they're patients that are coming on all of the time. And that's notwithstanding things like the strike action that is also having an impact on both urgent cases and other cases when they're dealt with. So we set our strategic objectives and deliver the plans and how to meet those. And obviously, whilst quality and safety is paramount in what we do, the letter that came out in November was also reiterating the NHS is expected to deliver on its plan. And you'll see on the next slide where we're ending up, or where we're hoping to end up. So next slide, please. So the factors, as we mentioned, that why we've spent more than we were hoping to. So the macro factors such as the cost of goods and services we all see around us, the cost of goods and services that we buy, whether it's fuel, whether it's energy, whether it's food, all of this has an impact both on our personal budgets, but obviously in corporate budgets and in the NHS as well. And then you also have microeconomic factors, so the competition for staff, patients' needs, the cost of services. People are changing jobs, they're leaving because they're getting better paid jobs elsewhere. The NHS obviously has been well documented in the various pay negotiations that occurred last year. There were backdated pay claims, both in nursing. Obviously, there's been a partial settlement, I think, in negotiation at the moment with consultants. And obviously, we've heard about the junior doctors strike that's ongoing at the moment. And then obviously our partners, we're trying to work more collaboratively under the guise of the ICB and the collaboratives that we have across the country. You're well aware of, for example, the work that we do in mental health collaboratives across the country and across the east of England, also in the prison service, which is, I think, unusual for a lot of mental health providers, but we actually have quite a wide reach. I'll hand over to Judith at that point.
Thanks, Saqib. Richard, can I have the last slide, please? So in this very sort of quick whistle-stop tour of our finances, did really wanted to end in a summary of where we want to be, certainly by the end of this financial year, which is a mere 3.5 months away. We were initially projecting a deficit of 10.4 million, but post the letter back that Saqib referred to in November of last year, we had to go back to the drawing board like all other trusts around the country. And we are now projecting a deficit of 4.8 million. Now, this is not an accounting trick. A lot of very detailed work has gone into it. A new subgroup has been established, which is the Executive Finance Recovery Oversight Group, which at one stage was meeting weekly to establish the parameters for how to reduce the deficit. And what has been designed is a real focus on a value programme that will deliver savings at system, organisational, divisional level. So it's an incredibly detailed plan. There continue to be challenges to this, and the challenges really are the challenges that Saqib have already referred to, the challenges around agency use and whether we can continue to reduce those, although we have done very well in the recent months, in the last 2 months of the financial year. There will continue to be vacancies, and vacancy rates have a direct impact on agency use. The continued problem around inflation, so the macroeconomic scenario in the country, utilities bills are going up, and that clearly has a direct impact on our costs. The strike, so pay settlements, is also another factor, just in a nutshell. Now, the reason why we believe, or the Trust is now projecting a much reduced deficit, is because of a number of factors. Some are focused around more efficient ways of working, especially around community care and urgent care provision. There's some progress that have been made with historic funding issues around pay award, and the costs of industrial action have in some instances been mitigated because we've received some additional funding. And we're also focusing, we have major projects around improving patient flow, which will support our acute trust partners within the ICB as well. Now, that is all a pretty sort of sobering picture. It is a stretch target to have that deficit of 4.8 million met in a mere 3 months, if you like. Where do we get assurance from? So, and there are 3 very specific, very distinct areas that as a NED I get assurance from. One, the first and most important is really, again, the committees that Sakib has already alluded to. I have been very fortunate in that I've stepped up to chair the Performance Committee, which is in effect overseeing finance. And that was about 7 or 8 months ago now, which has allowed me to not only have a more sort of real detailed understanding and access to Paul, who's our current Director of Finance, and Richard Wheeler, who was the Director of Finance before, but also really to get my teeth into a very detailed level on all the reports that come to committee. So the committee oversees the value programme at all levels. So we understand what has been delivered, what the forecast is to deliver to the end of the year on a monthly basis, what could be the bottlenecks, what could be the risks to it and the challenges, but also to really celebrate the positives, because there are positives within the financial picture too. There is a work stream for each of the projects within the value programme, and this has an executive lead as well as a clinical lead. So there is no threat to services being closed without, I'm not saying any services are being closed, by the way, but we are not at that stage at the moment, but it's really important to have that clinical input as well as an executive operational input into any plans to manage finance. That's really the message. We also have an update on the specific focus areas, which is how the trust is reducing overspend in any specific service, on how we're improving flow in our community and urgent care, on how we're dealing with medium-term financial planning. The NHS has totally and utterly stunned me, having having come from financial services, that medium-term planning really wasn't something that's been regularly done. Now, as a trust, we are now doing that because we recognise that next year the financial situation nationally and for the trust isn't going to suddenly improve. We will need to dig very deep and really work as part of the system under the ICB umbrella to ensure that we deliver savings. So I'm really pleased that we are quite a long way down the path of this medium-term planning. We also look after within the Performance Committee on the estates planning and the estate strategy, which directly supports our services. So the estates are not there to deliver just savings. The estates are there to deliver and support the services that we are offering to people in Northamptonshire. The second bow to the arrow, if you like, is the ICB. So I attend the Delivery and Performance Committee, which looks in effect at project work to improve efficiencies at ICB level, so at system level. And Melanie attends the equivalent of the Finance Committee. There's a terminology difference, but there we are. And by that, we not only understand what's happening with our partner trusts, but also what the ICB's thinking is. And also we can challenge to a limited extent as to what the thinking is within certain projects and certain deliverables. And thirdly and finally, where I do get assurance from is the service visits that we will, as non-execs, do. We have a sort of direct understanding of how staff potentially are impacted if there's a shortage, or if there's agency staff, if there are a number of vacancies, how they feel about, what the messages are that they are being delivered, if you like, what they're hearing and how that's impacting them, which we can then use to bring back to board and to the relevant committees. So taking these, this is my, if you like, my assurance stool, the 3-legged assurance stool that I use to assure myself around finance. And yes, it's a challenge, but I'm feeling confident that with all the work that is going on, we will carry on doing a really decent job at reducing that deficit, but certainly meeting it at 4.8 million at the end of the financial year. So I'm really happy to ask questions. I'm really happy to be asked questions. I don't necessarily have all the information at my fingertips, and Paul unfortunately is on annual leave. So if I don't have an answer, I will, so keep an eye between us, we'll get back to you. And Melanie's put her hand up first because she wants to ask me a really difficult question. I just know it.
I do. I've been thinking of the hardest question I can ask you. No, in actual fact, Judith, I would like to just add to your bit as an attendee at the Integrated Performance and Resources Committee, which is effectively a finance committee within the ICB. I just thought it was worth pointing out that through that committee, there has been a strong sort of focus and oversight of the financial management and control regimes within the ICS provider members. So there has been significant scrutiny on the performance of trusts in managing their finances and, you know, meeting the standards that the NHS expects. So that certainly has given me additional assurance in terms of how NHFT is performing in this area. So you did no difficult question today, but I hope that additional bit of insight might be helpful. Thank you.
Thank you, Melanie. I'm sure Judith is appreciative of the the supplemental rather than a challenging question. Julia, please.
Thanks, Krishni. I just wanted to add in another leg, as you described it, Judith, for the assurance around finance. Just to reiterate, as Sakib mentioned, the route for financial governance. Of course, the other element to this is quality. So we're constantly through the Quality and Safety Committee mindful of the risks around finance and the potential impact on the quality of services when financial issues become very challenging. So you'll see in the board report that comes from the Quality and Safety Committee this time at the end of January, there is mention to the fact that we take the opportunity to question when we see any impact from financial challenges, and we look very deeply at mitigations so that we can give you assurance, give the public assurance that we are looking at every part of impacts, the impact of any decisions around finances that may impact on the quality of the services we provide. So just an added layer of assurance, really. And the fact that Robin attends the Quality and Safety Committee at the system for us, and again has that sort of overview and perspective. Thanks.
Thank you, Julia. Robin, do you want to add to that?
Julie's largely said exactly what I was about to say. I knew she would get in before me. But governors need to be assured, really, that we are looking at this from a quality angle. So that something as simple as, you know, the amount of agency staff, that will be then side looked at from a quality angle as to what does this mean in terms of the levels of staffing. What does this mean in terms of the level of training that agency staff get, and all these kind of things, which further assure quality, so that even though these are financial considerations, they are appraised through that lens of quality. What are the implications of that for the delivery of services, right through into how much we can funding can be allocated, for example, to addressing waiting list pressures, which we looked at explicitly in the last Quality Committee just before Christmas. So really just adding to Julia's point, but it is really important that it is emphasised that quality is part of that analysis.
Thank you very much, Robin. Really helpful additional comment there. Matt, please. Matt Goldberg.
Yeah, thank you, Krishni. Thank you guys for the presentation. And as a partner governor, I just wanted to offer you some empathy from the local authority perspective, because finance is challenging wherever you sit in the system, isn't it? And we're all trying to square a circle that every time you look at the circle, it's getting bigger and bigger, isn't it, with all the pressures that we're dealing with. So I just wanted to offer some empathy, because we spend an awful lot of time talking about finance and balancing, like you've just talked about, care and quality with you know, against the financial decisions that we've got to make. And certainly as a governor, I can take some assurance from what I've been told this afternoon around the focus that that you guys have put in on it. But I just wanted to show a bit of empathy to say that, you know, everybody's dealing with this, and but it's good to see that it's a high priority, obviously driven by what you're being asked centrally to do. But I had one question, and that was around you mentioned some of the projects that you're working with. I wondered, are there any examples through your relationships with the Leicestershire Trust that are sort of driving any efficiencies, certainly from a financial point of view, at the moment? Thank you.
Thank you, Matt. I mean, I think it's fair to say, I'm conscious that Paul isn't here, but I think it's fair to say that that there are discussions about, you know, how we drive a common value program. You know, what are the shared efficiencies that we can deliver, and I think it's fair to say that is very much on our agenda, and you know, that could include sort of looking at any you know, contractual arrangements or backup, you know, shared, you know, procurement, shared back office functions, that sort of thing. So I think none of that is off the radar, and I think it's important to say that, you know, we will always look at those opportunities, because you know, bringing our two organisations together, we do some very similar things. So wherever we can drive efficiencies out of that, we will. But there's more work, I think, to be done on that. Probably there's nothing specific that I think I can add to that. Dave, I don't know if you wanted to comment on that at all.
Well, I mean, it is as you say, Christian. There's a big program of work now expanding into 24-25, looking at those opportunities. We've already made some good gains, particularly in technology services, and you know, sharing some roles there, and there'll be further opportunities that we'll be reviewing. I just also wanted to pick up in the chat, just in terms of service closures, we're not in that space, thankfully. That's not to say that there may well be options that we need to review over the course of the coming year, but we will of course keep people updated as we go through that as is necessary. But our ambition is to try and make sure we get through the next kind of 2 to 3 years in a balanced way for both services and for finances.
Yeah, thank you. I was going to comment on Pat's question, which David has helpfully commented on. So absolutely, you know, it's all about looking for efficiencies, not really cutting services. But that's not to say that, you know, obviously if there are things that we need to do differently, that could be different skill mix, or for services, or transformation process improvements, or technological changes. Those are things that, you know, we might collectively across the system look to do. But there are no planned closures, which I think people might be concerned about, which need to be considered at this stage. So important to confirm that. David asked, who funds the deficit? It's an interesting question. But just to say, really, I suppose the fair answer, and I'll ask executive, well, I'll bring Dave Mayer in, shall I, in case I'm unpolitical in my answer. Dave, do you want to comment on that?
Well, there's a bit of FT financial flexibility in terms of cash flow with DHSC. We're not there. We've got kind of cash in the bank, which supports cash flow. And then, of course, we have ongoing commissioning payments, which exceed the deficit position. So you're in a rolling kind of position of rolling out the year with underlying deficits. So it's broadly covered off in that way. But we haven't had an experience like other trusts where they've had to, you know, actually seek out loans from the Department of Health effectively to fund underlying pressures. We've been able to manage that with our cash flow and cash at bank. That would be that's a novice answer, by the way. So you know, I defer to Paul in all matters on this.
I mean, and I guess ultimately it is different. But I mean, you know, our responsibility is to achieve the plan that we agree with NHS England, actually. And that could be a deficit plan, in truth. indeed with the ICB. So I think that's the important thing. So all ICBs are in the process of agreeing their plan, you know, their current financial end of year position. And once that's agreed, that's what you're expected to deliver. And then NHS England manage the rest with Treasury, and is sort of beyond my pay grade to comment further on that. But certainly the important thing is delivering what we agree, which I think is, you know, as a principle, is the right one. So it is somewhat different, I think, from other organisations who tend to stand alone. Local authorities, I think, in a very different position to NHS organisations that are regulated differently, but important nevertheless. So thank you, everybody. Thank you particularly to Judith and Saqib for taking us through that and for all the supplemental points that people have made. Hopefully we've covered all the questions that have been asked. But, you know, as ever, I think important to say that balancing, hopefully what you got through all of that is it's, you know, one of our primary challenging but primary tasks as a board is to try and make sure we balance quality and efficiency and value for the public and the patients, and you know, that's the ongoing challenge that we'll be working on. So you'll hear more about that in due course. And probably what's worth sort of also mentioning really is that, you know, if you are able to join our board meeting, which will be taking place on the last Thursday of the month, the date of which now escapes me, but if you are able to join any part of our board meeting or watch it back later, then you'll see further discussions about performance and finance mentioned as part of that, as you would expect to see. So thank you very much for that discussion. That really brings us to the close of all our formal business for the Council of Governors today. Really grateful to everybody for their input and all the presentations and papers that have been prepared. And we've noted a couple of key actions and resolutions that I know people were keen for us to record. So I would just really thank governors and a final Happy New Year, because that's probably the last time I can say that to governors. But also a quick reminder really to council members that we are reconvening in a few minutes to cover probably one main item of private business, which I think we will conclude with Carol Phillips' agreement relatively speedily. So I'd be very grateful. It is an approval item, so I do need to be to ensure we're quorate. So I'd really be grateful if governors joined us in the private meeting, which is a separate link, in a few minutes' time. Perhaps enough time 5 minutes to have get a cup of tea if you'd like to. But if we could join and start that within 5 minutes, that would be really good. So we'll make a start at 16:47 precisely, and that will give everyone a chance to have a moment's rest. And then, as I say, we'll expect to conclude that pretty quickly, I would have thought, with Carol's permission. So thank you again, everybody, and see you shortly. And thanks to colleagues who won't be joining us.